We're really watching what's happening in other countries, how things are going in terms of vaccine rollouts and just how many people need to be vaccinated in order to try and, stop big outbreaks of especially the Delta variant. And, I think until we know what's going to happen with children and all those trials are done looking at vaccination in children, I think really it is just a watch and wait.
What are the possible scenarios with vaccinating children ahead in New Zealand?
Oh, look, we know that the trials are going on at the moment, so the data is expected in the next few months. I don't think there's going to be any particular reason why we wouldn't be vaccinating children. It is just a case of waiting for that data, because really that's what we need. One of the things that we're seeing is that although children are at less risk than adults for COVID-19, there are children that do get it, and they do have serious impacts from that, especially children that have underlying vulnerabilities. And we certainly have lots of those kind of children in New Zealand. So I think it would be an absolute travesty to allow COVID-19 to come here, without those children being protected.
Now, there's a lot of talk about countries having to live with the virus. Will that be the case for New Zealand, and what might that look like?
I think, we are all learning to live with the virus. For us here in New Zealand, that means elimination at the moment. It means stamping out outbreaks when they happen. So I think, it doesn't necessarily mean that learning to live with the virus would look much different. We may well treat this more like measles or rather than influenza. With measles outbreaks, we do try and stamp them out. We do contact tracing to stop transmission. So I don't see why that strategy would change. I guess the questions we all have are, what does this mean for international travel? What does this mean for opening up? And that's going to be the question. I imagine what may end up happening is that we'll have restrictions in place for countries that have high rates of transmission in their community. But this is really something that we're having to, watch and wait.
And vaccine passports for people coming into New Zealand and people leaving the country, do you think they will be implemented? And will they also apply when New Zealanders want to go to a restaurant, for instance? That's happening in Europe at the moment.
Yeah, I guess those things are happening because there is, widespread community transmission. That's the thing that we are not having here. We are, whenever we have an outbreak, and we haven't had one for a while now, but whenever we do have one, we try and stamp it out. So I guess that, the questions like that are going to come really when we see what the vaccine rollouts look like, how effective those vaccines are in other countries, especially as potentially the virus continues to evolve, and seeing what those new variants look like.
Where is New Zealand at with its vaccine rollout?
Things are going really well. So just this week, it's opened up to basically healthy people. So in our what we call Group 4, there's a mass vaccination event going on in Auckland over the next few days. So that's definitely rolling out. We're on schedule, which has been timed to do with deliveries of vaccines. So the plan is, if the doses arrive as they're expected to do, that we will have enough to vaccinate everybody by the end of the year. So it's just hoping that those, they continue to come on schedule, which they have done so far. But then I guess it really is a case of acceptance. We do know that there are some people in the community who don't want to be vaccinated, and then we still have plenty of people who are curious, who have questions that they need answering. So it really is on us, and in the scientific community and the government, to answer those questions so that people feel confident getting the vaccine.
How similar or different a path is New Zealand travelling on compared to Australia?
Well, I think, what we're seeing, obviously, is the difficulty with Australia having different states that are taking slightly different paths. In New Zealand, we at least have one response, one government. So, when we have an outbreak, there is only one way that it's dealt with. Obviously, what we're seeing in Australia is slightly different responses that are, putting, I guess, different people at risk. We're as we're seeing with New South Wales, that taking a little bit longer to try and stamp out the outbreaks means that it takes those outbreaks longer. And it's unclear at the moment how long it's going to take to get rid of cases in New South Wales. And they obviously put everybody in Australia at risk if you have people moving between the territories and states. And that's unfortunately why we've had to close the travel bubble. It's a real disappointment, but that puts us at risk as well. So yeah, it just shows the difficulty of this, and I guess it shows just how difficult that means it is in within the European Union and other places where some countries are open or more than others, just how hard it is to control when you don't have a unified response.
And just finally, when analysing COVID data, you believe we should not only be looking at the daily case and death numbers, but the long-term impacts of COVID.
Absolutely. So, we see this focus on how many people are hospitalized, how many people have died, but actually that doesn't tell the whole story of COVID. When this virus first emerged, I remember being extremely frightened of what it could potentially, how it could impact us. And I was thinking of viruses that cause things like Guillain-Barré syndrome, so things that are, maybe don't appear for months or years. Obviously, we know now that COVID causes long COVID, so people who have symptoms for many months. But the question still is, what does that mean long term? And there's been a recent study just released in the last few days that looked at sort of cognitive effects, so things on memory, all those kinds of things. And even people who didn't have severe symptoms of COVID have had an impact. And the question is, how's that going to play out in the next few years? Might we end up with people at high risk of dementia and things? So I don't feel like we're making those calculations of what the health impact's going to be, because that will have a massive impact on our economies.
Fascinating to talk. Dr. Siouxsie Wiles, thank you so much.
My pleasure.